So repetitive strain injury is a constellation of or lots of different conditions which can cause pain in your wrist and your hand. And one of the most commonest conditions is something called carpal tunnel syndrome. This is where you've got a major nerve in the wrist which supplies sensation to the tips of these fingers and also power in the thumb. I see patients who may be using mobile phones for a prolonged period of time or sitting and resting their wrists on a hard desk and typing for prolonged periods of time. You will start to see lots of pins and needles and numbness in your hands. And what's happening here is that your nerve is being squashed essentially. What that might happen is that over time is that it may cause permanent damage and scarring within the nerve. So the best thing to do for this is to really be aware of your environment and how you're using your wrist to try and avoid prolonged periods of time in using mobile phones or resting your wrists on hard surfaces. The treatment is based around resting it in a splint. Steroid injections can sometimes be useful, and in some cases where this is not helpful, then a surgical operation to release the nerve just at the front of the wrist here can sometimes be quite effective in relieving your symptoms.